Hello, Facebook.
Hello.
I'm Mary Beth Marsden.
I'm Don Scott.
Yeah.
This is GBMC Facebook Live, and of course we are Greater Living.
We have been greater living. Living greater.
Living greater as well.
We have such a great topic today.
Mm-hmm.
I think everyone was saying, we were telling people about it, wow, that's going to be tough, that's going to be hard. Oh, I think it's so important, and there's so much love around this topic, and the people who work in hospice care are amazing.
It's also one that's going to come as a surprise to a lot of people. If I can relate a personal story, I was doing something else for GBMC and interviewing a nurse, and I said, "Where do you work?" And she said, "Gilchrist." I said, "What do you do?" She said, "Well, I'm with Gilchrist Kids." I said, "What?" Because I, at that point, had never heard of hospice for kids. So we should ask the first question, I guess.
Yeah.
What's the difference between...
And let's introduce Mary Tiso.
Oh, I thought we did.
Mary
sorry.
Tiso is the clinical manager at Gilchrist Kids, and that's not who you met, is it?
That is not who I met. Debbie.
Yes, who I think is in our audience. Actually.
Awesome. We have a lot of people
okay.
from Gilchrist in our audience. Thanks, you guys, for being here and
Thank you.
being of support. And Mary, it's so great to see you today.
Well, thank you both for having me. I'm really excited to be here and to get to talk about the work that we do because it's really important and it is really exciting.
Let's start with basics, I guess. The difference between Gilchrist Hospice and Gilchrist Kids.
Yeah. So most people know hospice sort of as for maybe older people. Maybe you've had a grandparent or a great-grandparent who's needed hospice service at the end of their life. Maybe they've had a long journey with cancer or maybe Alzheimer's, and their condition has really deteriorated, and it's just really important to families to stay at home, make their loved one comfortable, and to sort of have a peaceful death in a home setting. Pediatric hospice is all of that, but it's a lot more too, which is really cool. So pediatric hospice serves infants, children, and young adults who do have life-limiting conditions. I think the diseases that we see are a whole lot broader than what is seen in the adult population. And our patients are unique in that they can receive concurrent care. So they can go back to the hospital, they can stay with the doctors who they've worked with for a long time, whether it's maybe an oncologist, a cardiologist, a neurologist. A lot of these kids have been with those doctors for their entire life. It's really important to the doctors that they continue to work with them and continue to offer the latest breakthroughs in treatments or medications. So our patients can receive all of those things. They can go to the hospital if they need to. They can also receive our services in their home. So we kind of just expand sort of their circle of care, which I think is really cool.
Is this relatively new, having hospice for kids?
So I think it's not new. Unfortunately, there have always been children who are dying. It's something that nobody likes to think about. But children have always died from, whether it be cancer or degenerative disease or chromosomal issues. I think what is new is in 2010, when the Affordable Care Act was passed, there's a provision in there for concurrent care for children, which says that children who receive medical assistance, who are under 21 years old, can receive hospice care alongside curative, life-prolonging treatment. So that concept is new, and I think that's why we've seen an uptick in the number of patients who are using our service, because a lot of times before, parents sort of had to choose. So maybe it was that we've decided that we want hospice, we're going to stay home, we're not going to go back to the hospital, we're not going to pursue new treatments or new medications. And now they don't have to make that choice.
That's amazing.
Yeah.
Because
really
I think
cool.
anyone who's lived long enough, who maybe had a parent or some relative, they had to make a choice as an adult about choosing hospice or not. So this way it's almost like everyone has hope for a very long time, and as long as they can use it for. So that is big. I would imagine, too, that for an adult hospice care, there are certain plans and programs in place already, but for a child, it's so individualized.
Absolutely. So I think that's one of the coolest things about our program is every patient and family are so different. And we have sort of the wraparound services to meet every patient and family where they are with exactly what they need. people are kind of able to pick and choose what part of hospice and what part of the team they really need the most help with. And then we're able to come in and kind of fill that void. So for some families, it really is the direct hands-on nursing care, the frequent assessments, the sometimes lab draws or changes in medications. For some families, it's more of the social support services that they need or linking in with resources. For some families, it's the volunteer program that we have. So maybe it's someone who's able to sit with their child for a couple hours while they do some laundry. So I think every patient and family would pick out and identify maybe what was most helpful to them.
Can you give us some more specific examples, like if you can even use a compilation of clients to kind of create a story?
Sure, yeah. So I think really depending on what the family system looks like, depends on how the family utilizes services. Some families, again, are still very, very linked in with their primary treatment team. So maybe you have a young child who has a cancer diagnosis, and they're really receiving a lot of their medical treatment maybe in the oncology clinic or in the hospital. They're going for chemo, they're going for frequent lab draws. So the nurse is still going to go out to the home and do the assessments, but maybe not as much of that direct sort of medical care. But maybe the family and siblings are really struggling with the diagnosis. They're worried about what is this going to look like. They're worried about what are things going to be like if this treatment doesn't work. So we have social workers, chaplains, we have a child life specialist, and again, our volunteers, who are all really just there to be support people, somebody for these families to talk to. And a lot of times it's very isolating to have a sick child, especially a child with a potentially life-limiting condition, because a lot of people don't understand. People don't know what to say. Sometimes they run away because they don't know how to act. So our team can come in, not that we're replacing friends or family, but we're able to say, this is what some other families have done who've been in your situation. We've heard your similar story before, and maybe these are some things that can help.
You seem to be keen on home care. Is there an inpatient part of it as well? Because that's what we think of when we think of adult hospice.
Yeah.
Somewhere you go to.
And that's a great point. So most people think of hospice as kind of a place, especially here in the Baltimore area, because the Gilchrist Center at Towson is so well known. People kind of think that the Gilchrist Center Towson is hospice and that hospice is a place, whereas really hospice is a concept or a philosophy. So the majority of hospice patients, not just here in Baltimore, but throughout the country, are cared for at home. However, there are inpatient centers like the Gilchrist Center Towson and like our pediatric inpatient unit that are for special circumstances. So we're really excited because Gilchrist Kids just within the past year opened our pediatric inpatient unit. It's at Gilchrist Center, Baltimore, which is downtown, not too far from University of Maryland. We have 4 beds that are just for infants, children, and young adults. So as you can imagine, trying to have a child cared for at an adult inpatient hospice facility, it feels a little weird because most of the patients there are older, and the nurses are really used to caring for older adults with different conditions. So we have specialty pediatric trained nurses who are here at this unit. It's a beautiful, bright, open space. We have a giant playroom. Everybody's super, super focused on making it a good experience. So it's available for respite. So for our patients who are on service whose families are maybe need to go out of town or just need a break from the care, maybe they're moving. You can imagine all these circumstances where it's kind of nice to have the kids maybe away for the weekend or for 4 or 5 days.
And maybe nice for them too, right?
Yeah, sometimes.
Right?
I think sometimes the kids don't always want to go home.
Yeah.
They get pampered there a little bit. It will also be able to be used for children who are at end of life, whose families decide that being in the home is really not where they want to be, but also that they don't want to be in the hospital. Or children are having really bad symptoms that we can't manage in the home. So sometimes pain gets really bad. Sometimes it's vomiting. Sometimes it's seizures. We're able to bring them into the unit, get them kind of tuned up, feeling better, and then hopefully to go back to home. So we're super, super excited to have this opportunity now.
I was surprised listening earlier today that how long do you usually have a patient for?
It depends. So we sort of always say that kids don't follow any sort of plan that we might think that they're going to. We're wrong all the time about what we think. So some of our patients are actually on service with us for years.
Wow.
Children are naturally resilient. I think we all know that. Their tendency is usually to fight, and their bodies can do things that can prove us wrong all the time. So a lot of times children will come onto service because they've had maybe a really acute illness, they've been in the hospital, and the family's decided, we're ready to go home. And then they get home, and then they get really good hospice care, and then they do really well, and they live, for much longer than we anticipated. So we certify our patients initially for that we think that their life is probably going to be about 6 months or less. And we continue to
But
do
you
that.
never know.
But they surprise
Yeah, you
us
never
all
know.
the
So I hear,
time.
so I hear.
Sometimes they even come off service. Sometimes
That's
they get
awesome.
better, which is really cool too.
So we are on Facebook and we're live, and we're taking your questions. We've had people who've written in earlier, and they have theirs as well. But I think John has a question for us already off of Facebook.
Sure, we have a question from a member of our audience, Samantha. How likely is it that a patient gets to work with MakeAWish Foundation, and what have been some of the wishes you've seen come true?
Yeah, so we actually try to link in all of our patients with MakeAWish if they are eligible. Some of them have already had a MakeAWish prior to coming onto service with us if they've been sick for a while. Unfortunately, you can't get 2 Make-A-Wishes, which is kind of a bummer, but there are other services out there who sometimes will do a second wish. So we try to make sure that if they haven't gotten a wish, that they're going to do that. Sometimes, so you sort of get the classic, I want to go to Disney World. There's a lot of kids who go to Disney, and that's really cool. There are resources down there at Disney for kids who are on Make-A-Wish. Sometimes it's like a shopping spree at the mall. So especially kids who maybe are too sick to travel, they get to ride in a limousine and go to the mall with their whole family and get to buy whatever the heck they want. And they'll buy stuff for them and they'll buy stuff for their family, and that's really cool. We had a child who really wanted to be inducted into the Army, and that was his Make-A-Wish, so he was inducted into the
Awesome.
Army.
Yeah.
It's really whatever the kids can kind of come up with. One of our other patients actually got a therapy swimming pool installed in their house, so it doesn't always have to be a trip. It's whatever the family really thinks is going to contribute to quality of
So
life.
a lot of your care could be very long-term, relatively speaking. How does that work with insurance, and is that an issue for you guys?
Yeah. So most insurance does cover hospice. Medical assistance is pretty much universally, if the child is eligible, they'll cover hospice. And most commercial insurances have hospice benefit as well. As long as we're able to sort of recertify that the child still has signs and symptoms that their life could be short and their life could be limited to less than 6 months, then insurance will continue to reimburse. We also have a great program through Gilchrist for families whose insurance isn't covering them but who are truly hospice eligible. We take every family's financial situation into consideration. We don't ever want anybody to have to make a decision to pay for hospice versus their mortgage or something
Yeah,
like that.
on top of everything else you're dealing with.
Absolutely. And a lot of our families are struggling financially because it's expensive to
Sure.
have a sick
And if our-
child. So we do everything that we can to make sure that they can receive their hospice care without having to worry about finances.
And if I remember my conversation with Debbie before, there were an awful lot of donations that come to the hospital earmarked for Gilchrist Kids.
Yeah. So our program really runs on donation without grateful donor.
Everybody.
Yeah. Just in case.
It's also a surprise. You'd think it would be funded by, the government or something, but
Yeah, so we actually don't get paid that much money by insurance. So hospice is covered by insurance, but when you think about all of the care that's provided, the amount that we get is not so big. But yeah, through grateful donors, we're able to have as many staff as we need. Our inpatient unit is really completely funded off of donations. So it's
Wow.
amazing that there are people out there in the community that recognize how important this is and how much the money is needed.
and hopefully there are more watching right now who,
Yeah, I
who
hope
would like
so.
to.
And speaking of the community, I think for a lot of people, in general, death is a difficult topic, and particularly when you're talking about a child. And you mentioned that the families often feel isolated. I can only imagine. And I probably have very close friends who want to help, who want to say something comforting but don't know how. And I would imagine even you yourself could be somewhere and they ask you what you do and you tell them and that people's reaction is, oh, but you want to say, no, it's wonderful and I'm helpful. And so how can we help the general population just get better at this?
That's a great question. So, I think it's sort of all lumped together when people ask what you do and you say, hey, you're a hospice nurse. They're like, ugh, pediatric hospice nurse? They like run in the other direction. It's so sad. How do you do that? And what I try to explain is that it's really sad that there are children dying in this country, and it's every parent's worst nightmare.
Absolutely.
But it's our job to make sure that if it is going to happen, that it's the best possible experience that it can, and that if it were my child, I would want a team of people around me who are supporting me, who were making things the best for me and for my child as there possibly could. So I think in the community, just to say, like, it's okay. No, we don't want to talk about it. No, we don't want to think about it. But if it were you or your child, what would you want? You would want this really great team of people who really care about you.
You certainly wouldn't want to be
surrounding you.
isolated, I wouldn't think. I
Right.
mean, to feel
Yeah.
lonely on top of everything else would be, just awful. And do you think social media is helping in any way? And I ask
do.
that. You do? Okay.
Yeah. I think that social media has opened up this world. A lot of our families, their children have pretty rare diagnoses. Sometimes they're like 1 out of 5 children in the world who have a condition. And that in itself is isolating. So it's not like, oh, my child has bronchitis. Oh, my kid had bronchitis
Right.
too, and we can kind of talk about it. So social media has opened up that there are people who can connect across the world. And for families, that can be really affirming and reassuring to know that you're not alone and to sort of talk through, this is what's going on with my kid, or wow, they were in the hospital again. And you get all of this support from people who truly understand. I think also when people are posting on social media that their child is on hospice and it's in this safe group with people who understand, maybe it gives somebody else an idea, or maybe they're saying, wow, my doctor started to bring up hospice and I didn't want to talk about it, but this family's on hospice and it seems okay, so maybe it's something I could think about. So I think it's been great.
It is amazing. You can ask the weirdest question on the internet, and somebody,
Someone else is
somebody
going
has
through
an
it.
answer
Absolutely.
or hundreds of answers.
Yes.
Speaking of questions, we have another question.
Actually, we have a comment and a question. One member of our audience wanted to thank the staff and members of Gilchrist. They've helped them
We all
through
do.
the
Hear, hear.
passing
Clap,
of
clap.
family and friends, and they said that you guys were really instrumental in helping them along and to accept the passings of those loved ones. So that was one comment for you guys. And also, can you comment on the effect and implications of parental and sibling guilt during and after the child's death?
Yeah, guilt is real, right?
Yeah.
So I think as a parent, anytime there's something going on with your child, we have the tendency to put it on ourselves. So even if it's just that they're misbehaving at school, you're like, what did I do wrong as a mom? They're not sleeping through the night. What am I doing wrong as a mom? It's my fault. So you can only imagine that when they're sick, that somehow the parents are feeling like they've kind of failed their child. I think some parents also see enrolling in hospice as maybe a failure. And that's why when it's first brought up, people don't want to hear it because they
feel like they're giving up.
They see it as
Yeah.
giving up. With concurrent care, it's not. So we are able to help maintain that hope.
It's just more care.
It's more care,
Right.
and it's bringing the care to families in the home, saving them a lot of times trip out of the home. I think siblings also, children experience emotions that sometimes they can't always verbalize, especially young children. And I think there is a lot of guilt. So there's a lot of, especially in young children, there's sort of this magical thinking that I was bad, so maybe I caused my brother's sickness. And we really try to address that with
How
families.
about guilt about the child who's sick is getting all the attention.
Oh, sure.
Oh, yeah.
And I'm mad
Yeah.
because I
Right.
want you to pay
Right.
attention
And now
to
I'm
me.
guilty because I even feel that way.
Yeah, it's real. I mean, it's definitely a very, very, very real thing. And it's something that we try to address with families and try to kind of bring out and unearth. Our child life specialist, who you'll hear from very soon, is wonderful with working with siblings and trying to kind of bring up some of those feelings that they're maybe stuffing deep down to try to bring it out and work through and make them feel better.
Which leads me to the question that once the child passes, if they indeed do, hospice care doesn't just drop off, right? There's a safety net there for the family to help them even through the grieving process and to move forward. Is that right?
That's absolutely right. So our same team, our Gilchrist Kids team, who's provided the care to the family during their journey on hospice, can continue to follow the family even after the loss for up to 2 years and sometimes even longer. So we can continue to provide support in the home. Our social worker, chaplain, child life specialist can all still continue to provide bereavement support. We also have a memorial service that we do every year for families who've lost children. It's a really beautiful day that just allows us as the team as well as the families to honor those lives that have really touched us. And so it's a nice way for families to sort of come back and circle back around and get to see the team again, and they can come as many years as they want.
At this point, we should say our first guest was Mary Tiso, Clinical Director of Gilchrist Kids. Thank you for talking to us, and thank you for what you do.
Thank
Yeah,
you so much. I appreciate
and
your
thanks for
time.
enlightening us.
Absolutely. Yeah. Thank you.
Thank you.
All of us.